So we're here because we hear when we go door to door in multiple campaigns, and you hear it both from our side of the aisle and the other side of the aisle, that the number one issue that Connecticut families face is the unaffordability of their health insurance and health care costs. Connecticut has become unaffordable among many issues, but most notably, its health insurance. We put forward an initiative this year that would not only reduce premium by 30%, but it would also get its arms around the high cost of health care, provide equity, and most importantly here in Connecticut, keep good-paying middle-class jobs. That's the only bill that did not get out of the Insurance Committee. The bills that did get out of committee were those offered by the Democrats, which was either a government-run health care system that would kill Connecticut jobs, or one that was proposed by the governor that puts a $50 million tax on insurance premiums in the name of lowering its costs. We have 1 week left, folks, 1 week. This issue has been long overdue. There was the passage of the Affordable Care Act some 7 years ago, and since then, Democrats who have held majorities have promised to reduce health care costs. Unfortunately for the Connecticut family, that has not yet become a reality. We have a better way. We've shown the better way. We're now asking Democrats to join us in that better way, to give the hardworking families of Connecticut the relief that they so rightfully deserve. With that, I'm going to turn this over to my counterpart in the House, State Representative Vin Candelora.
Thank you, everybody. And I guess just to reiterate what has been said, as we are moving forward with all of the federal money that has come in, we've seen a lot of that money going towards subsidizing a lot of our existing plans. And while that may be a good stopgap for the next 2 years, we need to begin the long-term planning of making healthcare more affordable. The public option, as everyone knows, sunk like a lead balloon this session, as it has every other session, because it's not an opportunity to make healthcare more affordable for the state of Connecticut. The residents, the industries, and the legislature realizes it's a failure. And so we are asking to put this back on the table, this reinsurance proposal that will go toward meaningful reform to reduce healthcare costs. Thank you.
Thank you very much, Vin. At this time, I'd like to introduce Stephanie Amato. Stephanie?
Good morning, everybody. My name is Stephanie Amato, and I am the president of the Connecticut chapter of the National Association of Health Underwriters. We're an organization that advocates for employers, employees, and individuals related to insurance benefits. Every day, our members work with business owners, families, and individuals to find affordable health insurance options. And although we see there is a need to expand access to affordable health care, the proposed tax on health insurance coverage is not the way to achieve it. For example, New Jersey implemented a similar policy to the one proposed here, and premiums rose by several $100s for New Jersey residents covered by the typical family insurance health plan. And recently, the federal government repealed the federal health insurance tax, saving workers and families on average of $500 in lower health insurance premiums. We know that imposing a similar tax here in Connecticut will again increase premium costs to us, the consumer. As local businesses and families are struggling to recover from the pandemic, now is not the time to make healthcare coverage more expensive. What we should be doing is helping our businesses afford providing health insurance coverage to their employees, since this is where more than 50% of the Connecticut residents obtain their health insurance. We should not be making it harder by imposing a tax that may force them to ask their employees to pay for more health insurance coverage or end up not being able to afford it at all. The proposed health insurance tax is bad for business, their employees, and we are urging our lawmakers to reconsider it. Thank you.
Thank you very much, Stephanie. Now I'd like to introduce the two ranking members of the Insurance and Real Estate Committee who worked hard to shepherd our better way through the committee did a lot of work in committee. Unfortunately, as I said earlier, the majority did not advance this initiative. However, it wasn't because of lack of effort on behalf of both Senator Wong and Representative Pavlak D'Amato. So I'll turn it over to them now to explain what they've got going on.
Thank you. I am State Senator Tony Hwang, the ranking member of the Insurance and Real Estate Committee. It was a tumultuous year in committee. We had the debate over the public option, but the Senate Republican and the House Republicans proposed a better way, a collaboration with our business entities, as well as an effort to contain cost. And I'll give certain examples of solutions that we provided. One, utilizing federal funds in the reinsurance component that does not have the hit tax that's proposed by the governor and the Democrats. Number two, we talked about using benchmarking as a basis to be able to make comparative cost comparisons in regards to the cost of healthcare insurance. Number three, we talked about addressing prescription drugs. We may have a very difference in regards to the governor's proposal, but we both understand the fact that prescription drugs is a major cost factor. The fourth component that is important is respecting transparency in an audit process. Every insurance product in the state of Connecticut requires oversight, transparency, and an auditing process by our Department of Insurance. Unfortunately, a state-run plan does not. So all of those four components are a better way. And I just simply wish that we had an opportunity to present that in debate in the Senate and the House to recognize that a collaborative effort with our major insurance holders, with shareholders, as well as the legislative bodies of both chambers, of both parties, is a much better way than a state one-size-fits-all prescription. That being said, I'm honored to participate in this press conference to share, as we get to a week left in this session, there is a bill out there that we could use to craft a better way. Because ultimately, we all agree, Democrats and Republicans, that the status quo cannot stand, that the cost of health insurance is at a rate that is unsustainable and unaffordable for Connecticut residents. But our solution recognizes it's a better way of collaboration and input from all shareholders, not a state takeover of health insurance. So I'll defer to my House ranking member, Representative Pavlak D'Amato.
Thank you. I'm Kara Pavlak D'Amato. I represent Bristol, and I just want to reiterate what my colleagues have said and also emphasize that we're in a unique situation. The federal government has given us additional funding for the exchange, and thus far we've had legislators putting out competition with the exchange. And so every employer, individual can go to the state exchange website and look to see if they qualify for this additional funding, which means lower premium. So I just want everybody to take advantage of that, and I want to thank my colleague on the other side of the aisle, Representative Kerry Wood, for being really cooperative and looking for solutions this term. And again, the feds removed that tax, and now the state is looking to put it back, and that's just very unfortunate as we're in these trying times after the pandemic. So thank you.
Any questions?